Now, not many people think about this, but your teeth could be telling you something very important about your health, and you may not even know it. Your next visit to the dentist could reveal a lot more than you think it might. Dr. Joseph Kravitz is here now to tell us 10 health conditions that can be detected by your dentist. Joseph, thank you very much for joining us today. Great to have you here.
Well, thank you for having me.
You know, it's probably the stuff of legend of cavemen, but there's that, I can't picture a movie in my head, but there's that sort of analogy of the guy in the Middle Ages or in caveman days looking at a prospective wife saying, "You've got good teeth, I want you." There's some truth in that, because the teeth really do reveal an awful lot about how healthy you are, don't they?
True, true. And like in the old days, they used to look in the mouth before they would buy them for the marriage.
Right.
But there is truth to that, and one of them is diabetes. Now, you can look in the mouth, and the gum tissues could be red. Say, come in for a hygiene visit, and you look in the mouth, and the gum tissues are red, but there's no plaque there. And you blow air on them, and they just gush blood all over the place.
Really?
It's terrible. But the patient was coming to me for like 6 years. There's been never any sign of that before.
The only sign is redness?
Redness, as well as profuse bleeding without anything. We sent her to her physician. She got taken care of, and so now everything is now okay.
Yeah, that's pretty amazing. Oral cancer is another issue, and I know that this is something that can be very much exacerbated or created by the use of tobacco products, whether or not you're smoking them or chewing tobacco or skull type products.
Sure. There was a study in 2007 that showed that if you had a gum disease, that you had a 63% increased chance of having a cancer of the pancreas.
Really?
And it didn't matter whether you smoked or not. So we can find red spots and white spots on the gum tissue that if they stay there for longer than 2 weeks, you should really have it checked out.
Heart disease is another issue that's very closely related to the health of your teeth and gums, right?
Yes, your teeth could be very loose, they could be painful, or you can have more cavities, your gums could be red, and your blood pressure could be higher, and you could not even know that it's in you. So we can send you to the physician and then have it checked out.
Now, what would a dentist see in that initial examination that would indicate to him the potential for heart disease in your teeth?
Right. Well, say you were looking at the mouth for a period of time, and it was normal, and they came in, their gums were red and had like a purplish, bluish halo around the gum tissue. So you see this color difference.
Really?
Yes. It's very clear.
You mentioned diabetes already, so we'll skip over that. Kidney disease is another thing that's related to gum and teeth health.
Yeah, you know, sometimes the patient comes in and the mouth doesn't smell very good, but every now and then the mouth will smell sweet, a strong, sweet ammonia smell that you can even smell through the mask. And that's indicative of some kind of kidney problem.
Really?
Yeah, you should get it checked out. Sweet breath can be deadly.
Yeah, and I mean a serious kidney problem where you're talking surgery or life-threatening?
Yeah, so you should get it checked out.
So bad breath is a potential indicator of serious health problems as well?
Yes.
Yeah. Osteoporosis, another one.
Osteoporosis, we can look in your mouth and we can see that your gum tissue looks grayish and green, and it just looks dead in one small spot. And that's because the bone has died below the gum tissue. And usually there's no pain, so you usually don't know that it's there.
Leukemia.
If you can see white spots on the gum tissue that are precursors to cancerous cells. And that can be very, very dangerous. And so it is good to have that checked out once your dentist finds it.
Almost everybody at some point in their life gets canker sores, or those really intensely sore little small. How do you tell the difference between something like that and something that's more serious?
Well, the canker sore has more of a red edge around it that has a white edge. And on the cancer look, so it has a red middle, it has a white edge with another red edge. So it's like Saturn. So it's like a planet from outer space. So it looks like it's
and that is
if it's longer there than 2 weeks, then you should have it biopsied.
Does it have the same sensibility, the same sensitiveness as a canker sore would if it was cancer?
No, you might not have any feeling there.
Okay, but you would notice that from inside your mouth something is just not right.
Right, and it also could be not only on your gum tissue, Doug, but it also could be on the back and side of your tongue where you can't even see it.
Fascinating. Sleep apnea. I had no idea that was related to gum and teeth health.
Yeah, sleep apnea. The patient lays back in the chair and they start to snore when they're talking because they can't get the air through the airway because the back of their tongue is blocking off the airway. So that's very dangerous because you can stop breathing several times per night, and so that can also be checked out with your physician.
Yeah, and one more that's very important. This can be an indication of bulimia.
Oh yes, bulimia. Well, in fact, that brings up a story related to acids. This patient came in once for a hygiene check, and I said, I bet you sleep on the left-hand side of your body. She said, well, how do you know that? So I sat her up, and there were 14 holes through her teeth because the acids from her stomach were coming up through her throat and dissolving her teeth, and she had no pain. She had no history of cavities. The acids from her stomach were destroying her teeth, and because we sent her to a physician, that actually saved the entire rest of her mouth.
And that can also be, I know that those stomach acids are highly related to esophageal cancers and things of that sort.
Yes, it can cause cancer of the esophagus.
Yeah, so it's hugely important to get checked out. And one last thing. Teeth health is often related to stress. What's the equation there?
Yes, well, especially with the economy now. So I see people having more and more problems because they're worried about where their next paycheck's coming in. And we're talking about food today, where the food's going to be for the table. And I find that people are having more problems. And I believe that if they go into their dentist and just kind of discuss it a little bit, that a lot of those problems can be alleviated because their teeth won't crack as much, because they won't have as many cavities, because they'll get some quick tips about how to prevent disease, and they could prevent a lot of major problems by reducing their stress.
Okay. Dr. Joseph Kravitz, thank you so much. I'm going to run home and gargle and brush my teeth right after this interview. Thank you very much for talking. It's really enlightening. Thank you.